Hello everyone, welcome to my channel. I hope everyone is having a wonderful day. Before starting the video, please hit the subscribe. Now this start video. In the 10th episode of Chicago Med Season 10, titled Broken Hearts, viewers were confronted with a heart-wrenching and unexpected death that set the stage for Dr. Mitch Ripley's Luke Mitchell, emotional unraveling. As one of the more tragic episodes in the One Chicago franchise, Broken Hearts combined the weight of a life-and-death medical dilemma with deep personal loss, throwing Mitch into an emotional freefall. The central tragedy of the episode involves a risky surgery performed on conjoined twins, but it's Mitch's painful loss of his dear friend Sully, played by an unnamed actor, that becomes the focal point of the episode's emotional impact. The medical team, led by Dr. Lennox, Sarah Ramos, is forced to make an agonizing decision regarding conjoined twins who share a vital organ. One of the twins has an aggressive form of cancer, while the other is healthy. Lennox pushes the parents of the twins to agree to a highly risky surgery that could save the life of one twin, with the hopes that the cancer-free twin would be spared. Tragically, things go wrong. During the surgery, the cancer-free twin unexpectedly dies on the operating table, leaving everyone shattered. Parallel to this intense medical situation is Mitch's own emotional turmoil. Throughout the episode, Mitch is seen trying desperately to keep his friend Sully in the hospital to receive treatment rather than be discharged back into the prison system, where his battle with cancer could be much harder. Mitch's motives are driven by his deep connection to Sully, whom he has referred to as a brother. Mitch wants Sully to spend his remaining time with his wife and child. But despite his best efforts, things take a devastating turn. Sully dies suddenly from a pulmonary embolism, just as Mitch's attempts to keep him in the hospital are finally about to succeed. This tragic loss sets the stage for Mitch's downward spiral. For the majority of Broken Hearts, Mitch remains surprisingly composed. He channels his frustrations in professional ways, fighting for Sully's right to remain hospitalized, rather than face the dire conditions of jail. He pleads with Dr. Stano, expressing how crucial it is for Sully to have time with his family, but the decision remains out of his hands. Mitch also shows great sensitivity in dealing with Dr. Lennox's delicate case, as he refrains from pushing her for answers about the conjoined twins, understanding the emotional weight of the situation she's facing. His professionalism and level-headedness throughout most of the episode showcase his dedication to both his patients and his friends. However, when Sully dies unexpectedly, it becomes clear that Mitch has been holding back emotionally. Mitch's shock is palpable. He had never anticipated this outcome, and the grief over losing someone he considered a brother hits him hard. Mitch's stunned reaction to Sully's passing is particularly impactful for viewers, as it highlights his deep emotional connection to Sully, and it serves as a reminder of the show's ability to weave compelling personal stakes into its medical dramas. Mitch's emotional state is further complicated by the fact that he has no real time to process the loss. Immediately after Sully's death, Mitch is forced to comfort Lynn, Sully's wife, who is overcome with guilt and sorrow. Lynn sobs, "I wasn't here. I should have been here," as Mitch tries to offer her support. This moment adds to Mitch's sense of responsibility and grief, as he struggles with his own feelings of helplessness. With Sully gone, Mitch is left with a void he is not yet prepared to face, and it's clear that this loss will have long-lasting effects on his emotional well-being. Another significant aspect of Mitch's emotional journey in Chicago Med revolves around his complex relationship with his girlfriend, Hannah, Jessica Meisel. Over the course of the series, Mitch and Hannah have faced numerous challenges, many of which stem from Mitch's devotion to Sully. Hannah has often expressed frustration with Mitch's unwillingness to open up about his past and his tendency to prioritize Sully over their relationship. Mitch's protective nature towards Sully has led to repeated conflicts, and in the past, these disagreements have nearly led to the breakdown of his relationship with Hannah. The death of Sully threatens to drive another wedge between Mitch and Hannah. Although Hannah has shown understanding and even acceptance of Mitch's strong bond with Sully, There's a limit to how much she can tolerate Mitch shutting her out emotionally. If Mitch chooses to grieve Sully's death on his own and continues to keep his feelings hidden from Hannah, their relationship could face another major test. Mitch's emotional isolation has been a recurring issue, and if he does not learn to open up, it could push Hannah away for good. In the wake of Sully's death, Mitch is likely to spiral deeper into grief and guilt, and the emotional wall he's built between himself and those around him might grow even higher. For Hannah, her patience with Mitch could wear thin if he once again refuses to confide in her. While she has forgiven him in the past for keeping secrets and pushing her away, the strain of dealing with Mitch's emotional baggage for yet another round could lead to a breaking point. Mitch's inability to cope with his emotions, combined with his tendency to bottle up his feelings, may place their relationship in jeopardy. The risk here is not only that Mitch could push Hannah away once again, but also that his mental and emotional health could deteriorate without proper support. If Mitch does not seek help or allow himself to process his grief, his emotional spiral could have far-reaching consequences, not only for his personal life, but also for his career as a doctor. The broader implications of Mitch's struggles on the Chicago Med storyline, as the fallout from Sully's death continues to reverberate through Mitch's life, it's clear that Chicago Med is setting the stage for a major character arc for Mitch. His downward spiral is bound to affect his professional life, as his emotional turmoil could interfere with his medical decisions and his ability to remain the steady hand that patients and colleagues alike rely on. It will be interesting to see how Mitch's mental health is portrayed in upcoming episodes and whether he will be able to find the support he needs to recover from such a profound loss. This episode also highlights the emotional stakes that the One Chicago series as a whole is known for. While Chicago Med has long been recognized for its gripping medical dramas and intense procedural stories, it is the personal narratives of the characters, particularly in moments of crisis, that elevate the show. Mitch Ripley's grief over Sully's death represents just one of many emotional journeys Chicago Med explores, and it will be fascinating to see how the series continues to tackle themes of loss, grief, and personal healing in future episodes. As Mitch continues to grapple with the loss of Sully, it will be important to see how the show addresses his healing process. Chicago Med has a knack for portraying the personal struggles of its characters with authenticity, especially when it comes to mental health. Mitch's tendency to internalize his emotions and avoid confrontation could be a central theme in upcoming episodes. He may need to confront his feelings of guilt, as he may harbor some responsibility for Sully's death, feeling that he couldn't save his friend despite his best efforts. This kind of emotional burden could weigh heavily on Mitch, pushing him into isolation or triggering a deeper mental health crisis. One possible avenue for Mitch's growth could be a gradual realization that he can't navigate his grief alone. His previous reluctance to open up about his past and emotions may have contributed to the strain on his relationships, especially with Hannah. The death of Sully could serve as a wake-up call for Mitch, making him understand that pushing people away may only deepen his pain. If Mitch decides to seek professional help, it could be a pivotal moment in his character arc, showing that even doctors, who are often expected to be the strong, unshakable ones, can struggle with their own mental health. This would also provide an opportunity for Chicago Med to explore the broader theme of the mental health challenges healthcare professionals face, something the show has touched on before, but could delve deeper into in light of Mitch's struggles. For Hannah, the journey ahead could be just as challenging. If Mitch starts to push her away again, she might have to make a difficult decision about whether to continue fighting for their relationship or move on for her own emotional well-being. Despite her understanding nature, there's only so much one person can give when the other refuses to let them in. Hannah's own journey of supporting Mitch while maintaining her sense of self could evolve into one of the most compelling arcs of the season.